Hello, hi, good evening, friends. I am Dr. Sugeeta. I'm a nutritionist and a health educator and a Ayurvedic specialist. So today we are going to discuss about the topic that is eating disorders. This is the topic which is least talked about. So whenever we discuss about eating, the first thing which comes to our mind is food. Food is a fundamental of our life. Our life revolves around food. But are you aware there are few people, or we can say there are many people who can't eat food, or those who have adverse reactions to food? So whenever we talk about eating disorders, what the first thing comes to our mind? Most of the people would believe it is a psychological problem. Some would say, I'm sure, would say it is a social disorder. But few people know that there is a biological aspect to this problem. So agendas of our discussion today is going to be, first agenda would be eating disorders, its definitions, types of disorders, second would be the treatments, third would be coping with the disorders, and we'll be taking up the Ayurvedic viewpoint also, and then we'll be concluding about our discussion. So what is an eating disorder? Eating disorders are a serious type of mental disorders. They are characteristic by severe disturbance of the eating behaviors and related thoughts and disturbed behaviors. Eating disorders involve disturbance in eating behaviors. People with disordered eating may have an unrealistic body image. They judge their worth by their distorted perception of the body or shape. They don't feel good in their body. They feel that typical kind of a body is definitely good, and they have trouble seeing the positive qualities the others see in them. There are different types of disorders. Some people they acknowledge their problem. Others they are not even aware of their problem. Anorexia nervosa is usually one kind of a problem which is usually not diagnosed, because the people with this kind of disorders don't even know that they are experiencing it. So what are the characteristics of a patient with the AN? They usually show OCD behavior. They show obsessive behavior. They are very particular about one thing. They keep on doing the same thing again and again. They might have personality disorders. These people are usually introvert people. They don't want to share their feelings. So they usually don't have a big group of friends. They are usually rigid people. So these are the persons who have anorexia nervosa. So when the person is not eating proper food, not eating according to the body, not eating according to their height, so definitely the person is going to develop some health risk. So these are the health risks which are associated with anorexia. Factors which we consider are a reason behind this eating disorders are psychological factors, interpersonal factors, social factors or the cultural factors, and of course we have already discussed a few things about the biological factors. These are the non-medically recognized disorders. Usually they are rare, but they are definitely prevalent. Compulsive overeating, diabulimia, orthorexia nervosa, drunkorexia, pregorexia. So how do we assess that a person is having this eating disorders? So assessment is usually done by the physical examination. We check the weight, blood pressure, temperature, and hair, heart, lungs. Everything is checked by the doctor. Tooth enamel is also checked for erosions, and the gums are also checked. Nutritional assessment, evaluation is also done by asking the person about their eating habits, their eating patterns. Biochemistry is also done to check whether they are deficient of some kind of minerals and vitamins. And one most important thing which is very important for the assessment of this disorder is the interview of the person. Screening for depression, self-esteem, anxiety, appearance, mood behavior, thinking, memory, substance abuse, physical abuse, or sexual abuse is also asked about. Some mental health disorders are also checked if they are prevailing. Eating disorders, how they can be treated. So there are three lines of treatment. First is that you have to do prevention, and then there is a medical intervention, and third is the nutritional intervention. A person, these are the self-help tips which which all of us must include in our daily life. This is the very important one proverb which I saw somewhere and I liked it so much. The first step to solve the problem is to acknowledge the issue. So tips to stop binge eating: stop restricting yourself, make sure you eat the meals at the proper time, plan out your meals and snacks in advance. One must recognize foods are not good or bad. They are not usually the culprits. Late night snacking, usually due to hunger or boredom, should be avoided. Zoning out in front of the TV or other form of numbing outs, stressful situations should be taken care by opting for other mechanisms. So people usually ask how much time it's going to overcome any eating disorders. So this is kind of a problem. Some people, they usually come out of this problem. Some learn to handle the problem, and some usually take lot of time to recover from this issue. So these are the 5 general rules of recovery. Change your life, get hold of your life. You only can help yourself. Be completely honest with yourself, with your feelings. Practice self-care. Don't bend the rules. If you have given yourself a set rules, don't bend the rules for your from time to time or from emotional disturbances. Ask for help. So Ayurvedic view on eating disorders. Ayurveda is 5,000-year-old Paddhati, and it is definitely, it in that time also knew about these kind of disorders. So there are 3 types of people: air people, fire people, and water people. So eating disorders, so we can conclude that eating disorders are unhealthy diet practices that can easily in of hand and are difficult to break. Eating disorders are serious clinical problems that require professional treatment by the doctors, therapists, and the nutritionists. Mantra. The root cause of the mantra is root cause removal, and natural unpinning of the illness requires a holistic approach. What raw fruits and vegetables are best energy source for a diabetic patient? For a diabetic patient, the fruits like apple, papaya, guava, jamun are usually recommended, and vegetables like gourd family. The bitter gourd is very good for a diabetic person, and parval, the pointed gourd, is very good for a diabetic person. Drumsticks are also very good options for a diabetic person. There is a question a person is asking. He is a lactose intolerant person. What other product he can take? If you are lactose intolerant, it's not necessary that you will be intolerant to curd or the buttermilk also. You can include buttermilk and curd in your diet. You can include soy milk. You can include almond milk or coconut milk in your diet. Vegan diet is the sattvic diet or the ahar, which I already discussed. It's definitely a good diet, but the only condition is that it should be rich in all the nutrients. Thank you so much, all of you, for being so patient and asking so wonderful queries.